Welcome to Better Health Guy Blogcasts, empowering your better health. And now, here's Scott, your Better Health Guy. The content of this show is for informational purposes only and is not intended to diagnose, treat, or cure any illness or medical condition. Nothing in today's discussion is meant to serve as medical advice or as information to facilitate self-treatment. As always, please discuss any potential health-related decisions with your own personal medical authority.
Hello, everyone, and welcome to episode number 50 of the Better Health Guy blogcast series. Today's guest is Dr. Rachel Fresco, and the topic of the show is microbiome balancing. Dr. Rachel Fresco is an acupuncturist, PhD, and founder and CEO of Bio-Botanical Research. Since 1989, Dr. Fresco has utilized her background in naturopathy, Chinese medicine, and clinical nutrition to create products that have a significant impact on challenging clinical conditions. Addressing the challenges of microbial overgrowth as well as supporting the digestive and immune systems, her formulations have helped thousands of people around the world. Her most well-known product is Biocidin. Biocidin is recommended by many clinicians and laboratories in support of those dealing with conditions such as Candida, Sibo, and other GI dysbioses and biofilm-associated disorders. Her formulations have been helpful in those with systemic chronic infections, including Lyme disease. Dr. Fresco lectures internationally at medical conferences and shares her research on chronic infections, biofilms, GI dysbiosis, systemic inflammation, and the use of plant-based medicines in clinical practice. I have personally used her products many times after my first exposure to them almost 20 years ago, which was well before I knew I was dealing with Lyme disease. And now my interview with Dr. Rachel Fresco. So I have known Dr. Rachel Fresco for many years and have found her formulations to be very helpful personally and also with other people that I've interacted with over the years. I'm very excited to learn from her vast knowledge today, and she is my special guest on episode 50 of the podcast, which is amazing. So thank you, Dr. Fresco, for being here today.
I'm excited, Scott. I look forward to this.
Thank you. So tell us a little bit about how you became interested in health and wellness. Did you have a personal experience yourself with your health that kind of led you to doing the work you're doing today?
Yes, that's exactly what happened. In fact, I don't know if you know this about me, but I used to be a professional horse trainer and riding instructor. And I came to California to work in Pebble Beach at the Equestrian Center, and I was training horses for like the Mexican Olympic team, and I was a horse girl, and I was about 19 at the time, and I went in for my annual OBGYN visit, of course, to Planned Parenthood, who we all love, and it turns out I had a positive on my pap smear. So I went back again and it was still positive and it was class 4. So they suggested that I see another doctor because it might require surgery. So I saw that doctor and he was saying that they would have to take out my cervix basically. And I'm 19 years old. I'm like, why, is this happening? In the meantime, a friend of mine was a teacher at a health and wellness program in Monterey, and he said, Rachel, you should really try acupuncture. I'm like, oh, okay, I'll try anything. So I went to see this Korean doctor, Wajah Kim. She's the #1 license in California. Like, she's the oldest practitioner in the state. And she took my pulse and she looked at my tongue and she's like, basically, you have blood stagnation in your lower burner, whatever that meant, and I can fix this. Give me 6 weeks. I'm like, really, 6 weeks? So no herbs or anything, but I went in and twice a week she did cupping and acupuncture, and it was really interesting because the cups all came up like black and blue, like so much stagnation in my lower abdomen and my low back and my sacrum. Anyway, sure enough, after 6 weeks, I went back to the doctor and I got the pap again, and it was negative. Wow. And then instead of being happy that I got better from using acupuncture, he told me to get the hell out of his office. At that moment, I was like, I'm going to be an acupuncturist, I'm going to help other people. This is ridiculous. So, horses too. I mean, I was doing a great job with what I was doing, but I was never going to be able to afford to not live in a hovel behind a barn on the riding instructor salary in Pebble Beach. So I was glad to think about going to school, and I went to Five Branches University here in Santa Cruz, and that's a master's program in Chinese medicine. And after I got out of school, I was working at Con Herb Company as a technical consultant to doctors. So that's kind of how I got into it. I still have horses. I still train horses for fun.
Nice.
And love that. But that kind of put me on my path into medicine.
So I think people are probably most familiar with your flagship product, which is Biocidin. So how did that kind of come together? And then I knew of it as far back as 20 years ago and actually used it that long ago. And so at that time, what were some of the things it was being used for? I know in my case, a practitioner was using it more for gut dysbioses and for parasites, but how did Biocidin kind of emerge?
Right. Well, because of my work in veterinary acupuncture, so I was working with a vet part-time, and he had been treating like really expensive, like $1 million cattle with brucellosis and these other, incurable infections according to Western medicine. And we also have like a pack of hunting hounds with leishmania, which is also not treatable by Western medicine. And so we were using this herb formula that he had, and we were getting good results. And so having seen that results with the animals on these difficult to treat infections, when doctors were calling Con Herb Company and they were saying, hey, the long gone, shed gone tong, Chinese herb formula quell fire, it's not working for my dysbiosis people, particularly these people with AIDS that had opportunistic infections. And a lot of those diarrheal diseases were killing these AIDS patients, and they weren't even, that hard to treat, but there were no AIDS drugs then. So I had that formula, and so I sent it to some of the doctors in San Francisco, and they were getting good results with their patients. So one of those doctors, unbeknownst to me, sent it to Great Smokies Diagnostic Labs. So I got a phone call out of the blue one day from the director of Great Smokies, Dr. Martin Lee, and his words were exactly, I don't know who you are or what this is, but it kills everything. And I'm like, okay, is that good? What does that mean? He said, well, we have this CDSA panel, and we use candidate substances to see what's going to work on these yeast and bacteria. And your formula works every single time. I'm like, that's great, isn't it? He goes, yeah, what do you call this stuff? And I'm like, well, I call it bioradiance. He goes, that sounds too new age. Call it something else. So I'm like, I thought about it, and I thought about, okay, this is going to Western docs. It needs to be sounding and looking more like a pharma product. So I decided to use the, dark blue medical look and get rid of my purple flowery bioradiance thing. And I called it Biocidin because it's killing something, right? So that's how Biocidin came to be. And then that lab was running like 200,000 patient tests over a 6-year period that the Biocidin was on the panel. And so we had tons of doctors being referred to us, and I had to actually start my own company because I couldn't meet the demand for the product.
That's a very good problem to have, and knowing that you're helping a lot of people too is very, very rewarding. Tell us a little bit about some of the herbs that are in Biocidin, and what's the difference between individual herbs and then a formula that kind of results like Biocidin? And then what are some of the herbs in Biocidin intended to do in terms of supporting the body?
So the first ingredient in the Biocidin is bilberry, and it's a very antioxidant and inflammatory agent, but it's not only antifungal and antimicrobial, but it really helps heal the gut lining. And then you've got, immune modulators like noni. Actually, the research on noni is interesting. It's one of the strongest immune modulators out there. So that's very helpful because you need to balance the immune system. It could be overreactive or unreactive, and you don't want to push it in either direction, but you want the body to get into balance there. And then you've got basically your kitchen sink of antimicrobial things. You've got garlic and oregano and berberine-containing herbs like golden seal and gentian. You've got fumitory, which is a North American antiparasitic herb. You've got all of these things that work together to make a very broadly acting formula. And we also added some other essential oil components like the lavender, galbanum, which is another good antimicrobial and antiparasitic. So you've got a little bit of milk thistle in there as well for the liver, and a little bit of extra immune support with the shiitake, which is also antifungal and antiviral. So almost all of the herbs in there have more than one activity against either yeast, bacteria, fungus, or virus, or parasites. And they all turn out to be very effective on biofilms. We can talk about that more later.
Yeah, absolutely.
But the difference in using a formula like this versus like a single ingredient, like have you ever used like straight oregano oil capsule?
Sure.
It's very effective, very powerful, but it can be a little harsh on the stomach. Some people can't tolerate it. And most of the time, the people who need this Biocidin formula have had long-term chronic problems, dysbiosis or Sibo or Lyme disease. These are all things that you have to treat for a long period of time. So the formula can't knock you out of the water. You have to be able to take it and feel good while taking it, and slowly but surely correct, the microbiome.
Absolutely. So let's talk, you mentioned some of the types of organisms. So what are some of the types of organisms that people have seen positive benefits with using Biocidin? Would we say that it's effective for supporting people dealing with bacteria and viruses, parasites, and fungi? And then when in this whole kind of evolution of the Biocidin product did you start recognizing that it could also be helpful for people dealing with Lyme disease?
Right. Well, as a nutritional formula, of course, we don't make any drug claims or medical claims for nutritional supplements. So let's preface anything we say with that. However, doctors use these as support for all of those types of conditions where you've got some type of pathogen at play. Because if you look at any of the individual herbs, you can go on PubMed, for example, and you could type in berberine, right? Or golden seal, and you'll just find hundreds and hundreds of studies that have been done on the antimicrobial effectiveness of that herb. So that's the kind of research we do, is where we're looking at all these different ingredients and how broadly acting are they, how are they going to help, and how safe are they? Are these things going to cause any problems? And one thing I'm really proud of is that in the 30 years almost, now it's been 27 years that I've been working with this formula, we've had almost no problems with it, other than if somebody has an allergic reaction to a specific ingredient they have an allergy to, or your typical die-off reactions, but we can talk about that more. A die-off reaction is not a side effect, but you have to know how to handle that. And that's why we recommend these products to be used with your healthcare practitioner or with a knowledgeable nutritionist or some other person who has experience in using these, because it's not like a tincture from the health food store. They're very concentrated. They're very powerful. How you use it, some people could only take one drop or even one drop in a glass of water. So it's not like you could take a whole dropper full like a tincture, from Gaia, for example. So it's kind of a different kind of formulation. It's very concentrated the way we manufacture it, so that people have to understand right away that this is not your typical herb formula.
Yeah, and I want to underscore that as well. The purpose of this conversation today is really for people to learn, but it's not to empower people to go out and self-treat and do all of that. These conditions are complex, and certainly there should be someone who is on their medical team that's providing some guidance when they're using something like your products. Right. So I think that's really important. So let's talk a little bit about antibiotics. So when someone does antibiotics, let's say for Lyme disease, they often have to take several different antibiotics to address the different morphological forms of Lyme, the spirochete, the cystic form, the cell wall deficient or L form. So do we know, when we use something like Biocidin, do we know if research has shown that it's effective against all of those forms, or do we need to do something else beyond Biocidin to address the different forms of Borrelia?
That's a good question. So, of course, we never want somebody to not use their antibiotic that their doctor has recommended. Mm-hmm. However, we did in a in vitro study. It was a year-long Lyme research project with the University of in Finland. The ILAD's research director for Europe is Leona Gilbert, and she approached me because she had tested the Biocidin and she saw that it was effective, and she wanted to do a larger research project. So she tested it on the spirochetes, the blebs, the round bodies, and the biofilms, and she tested it also with antibiotics to see would it help some antibiotics work better. She also checked to see if there was intracellular penetration and so forth. So we were looking at a broad range of spirochetes from North America and Europe. I think she did all all the known strains. And the good news is that you can see in this chart I've got behind me, I don't know if you can see the top of that chart, but there's like a graph there. And let me tilt my computer up a little bit. There you go. So you see that graph? That was the death rate of the Borrelia. So it was very good. And we used both the regular Biocidin and the liposomal Biocidin in this study, and both were effective. And the cool thing was that a lot of antibiotics will cause the spirochete to like curl up into this round body form, which is a persister type form, and it's hard to treat. But the Biocidin did not cause that reaction. So it just killed them without letting them go into the persister form. So that was good news. And now, of course, all of this is in vitro, and it's yet to be determined as we continue to do clinical trials, the exact results in people. But the feedback has been very positive, particularly in people who may have some neurological symptoms still. And because the Biocidin penetrates intracellularly and through the fats into the nervous system, that seems to be helpful for those people. There also has been comments that you could use maybe less of the antibiotics when you have the Biocidin on board, and that's probably because the Biocidin inhibits the efflux pump, which is what causes drug resistance. So if you can imagine, here's your bacteria, your antibiotic is coming in, the bacteria senses that and just kicks it out, okay? But something about a lot of the ingredients in Biocidin shuts down the efflux pump. So the plant tannin category does that, the berberines do that. And so now the antibiotic can actually be more effective. So you may be able to reduce the dose. So when we did, for example, this checkerboard analysis with ceftriaxone, you could use like 1/8 of the amount of the ceftriaxone to get the kill rate that you would have needed when you had the Biocidin on board. So this is all, again, has to be borne out clinically, but at least in the research, we definitely see some synergy, and we definitely see some assistance to antibiotics with these herbs.
We need to get you some hand puppets, then you can do some more. So let's talk a little bit about biofilms, which you mentioned. So biofilms are another common reason that treating Lyme disease can be very difficult. And so the organisms themselves are kind of protected by this slime layer that makes it difficult for things that we take, but also for the immune system to really get to the microbes that are kind of protected within it. So what has the research suggested around Biocidin in terms of its effect on organisms within biofilm colonies?
We did a study with the University of Binghamton in New York in 2013, and Dr. Claudia Marquez is considered like the most renowned biofilm researcher internationally, and she found that the Biocidin, basically the same death curve on the biofilms that you saw here, it broke the biofilms, it killed the pathogens, and it did so whether the biofilms were single pathogen or multi-pathogen biofilms. And she also not only tested bacteria, but yeast like Candida. So she did the biofilms of Candida. So, and then in the dental studies we've been doing, this is played out as well. And in the Lyme study, she got the exact same death rate for the biofilms that Claudia did. So that was nice to have two different universities find the same result. But it's not magic. I mean, when you look up, again, if you look up PubMed and you look up biofilms and botanicals, just about everything that's in the Biocidin is listed as having had a study on it for biofilms. And so this is why when you have chronic infections of any kind that may have a biofilm component, it's a good idea to use herbs along with whatever else you're doing, like sinus infections, chronic sinus infections, chronic GI infections, things like chronic UTI, all biofilm components, ear infections in kids. Those are all, and of course, dental infections have biofilms. So it's a good thing if you can break the biofilms.
So we know that there are good biofilms and potentially bad biofilms within the body. So when we're using an herbal formula like this, do we know if it has an effect on the protective and healthy biofilms as well, or only on the ones that are bad, essentially?
That's a good question. So our friend in Netherlands, Dr. Jeroen Haas, he's the head of the Orthomolecular Society, and he has a very large Lyme and autism practice. So he did a study basically on 1,000 patients where he gave them Biocidin but didn't give them probiotics, and then checked before and after their microbiome. And what he found was an increase in the number and diversity of beneficial organisms with the Biocidin on board. So it does not appear that Biocidin will hurt the good bacteria and good biofilms. However, if you're using the Olivirex formula that we have, which has a very, very potent form of olive leaf extract, olive leaf sometimes can go after some commensal bacteria. So we put together a probiotic called Proflora to help balance in case that should happen, because a lot of times when people have Lyme, they're on both the Biocidin and the Olivirex. There's a lot of secondary viral infections that happen with Lyme, as you know, HHV6 and EBV and CMV. So it's important to address those. And even though the Biocidin in and of itself has some antiviral activity, we like to include that Olivirex in the protocol. In fact, whenever we have a really difficult infection, we like to use both together.
One of the things that I've heard people say over the years is that with antibiotics, you really can't start slowly, because if you start with a low dose and work up, then there's potential resistance that happens. So when you're starting with something like Biocidin, is there a risk of starting too slowly?
I haven't seen that. And maybe it's because, like I discussed, the efflux pump mechanism of antibiotic resistance. So if you just put in a low amount, you've already trained those things to turn on their efflux pump and kick it out. And so hitting it hard and fast might be better with an antibiotic. But with ours, there doesn't seem to be a problem with resistance. You can start slowly and work up per your tolerance, which is, I think, better. Nobody wants to feel horrible when they're trying to get better. They already feel bad, you know? Right. So it's better just to do things as people can handle it. We have a whole protocol with the Gi Detox for mopping up toxins as you're breaking up the biofilms. Remember, the biofilms have this endotoxin called LPS that are part of that coating layer. And that endotoxin is what causes systemic inflammation. So if you can grab that and get it out before it gets reabsorbed through the hepatic portal into the blood circulation, you'll cut down on the amount of Herxheimer or die-off reactions that people have. So we like to include that as part of the protocol too.
Absolutely agree. And I like that GI Detox product as well. Let's talk a little bit about parasites. So is Biocidin something that can potentially help support people dealing with parasites? And if so, is it more the smaller protozoan type organisms, or does it also seem to help with larger worm-like helminths and nematodes and things of that nature? And do people ever report seeing parasites exiting the body when they're using the Biocidin product?
We've had some interesting feedback on that. We've definitely seen people expelling parasites. We've used it on tapeworm, pinworm in children, as well as other amoeba forms. The dental DNA we just did on a root canal cavitation showed an amoeba in the cavitation, in the bone. And then after the use of Biocidin, the follow-up test, the amoeba was gone. So, and we've gotten feedback over the years for people using it for parasites that it has worked well. There's several strong antiparasitic ingredients in there. So it's definitely going to help with parasites.
What about some of the common things like blastocystis and Giardia and Cryptosporidium? Would this be a consideration for someone potentially to explore Biocidin with their doctor as well?
Yeah, we've done some research on that. So we've had before and afters go negative with Cryptosporidium and Giardia and Blastocystis hominis, but some of those cyst type of parasites, they go into like a dorm body stage, right? They've got like a true, cyst wall, and they can live for up to a year before they hatch. So it's really important to treat long enough when you're dealing with those kinds of parasites. Like we do 3 to 6 months, and then we do a maintenance for 7 to 10 days during the month. During the full moon, apparently, is when the blastocystis tends to hatch. So if you do 3 days before and 3 days after the full moon, again with the protocol, and continue that out for another 6 months after your original course, we have a good success rate, but it's not 100%. Dr. Leo Galland is a famous parasitologist in New York, and he compared using that protocol to something like Flagyl, And I know there's better drugs out there now than Flagyl, like Alinea and Humatin, right? But at that time, he was using Flagyl. But he found that the Biocidin was equally or more effective than that drug for those long-term chronic parasite infections. But it's something you have to really follow up, and you may need to do rounds.
Yeah, and I think one of the beauties of herbs is I think a lot of times there's so many things that it's doing that we don't really even know about today, other organisms and things that we don't have names for, where a lot of times the pharmaceuticals are a little more targeted. I think the herbs have a more broad spectrum potential to address lots of different things in the body, which is really, really cool. Let's talk a little bit about Sibo, or small intestinal bacterial overgrowth. It's a big topic these days. I think in the last few years, it's come up more and more, especially in the Lyme community, many people dealing with lots of gut issues. I have talked to people that have done Xifaxan to deal with their Sibo, and they seem to maybe feel a little bit better, but then when they stop the antibiotic or Xifaxan treatment, they often see that some of the symptoms come back. So what is known about the use of Biocidin for Sibo? How long would someone potentially take it? And then are there other products in your formulary that you should pair Biocidin with in order to really effectively deal with Sibo?
That's a good question. And we did a research project with Dr. Danielle Lewis on Sibo. So we tried first having patients do the before breath test. Then we found that they had Sibo, and then just on Biocidin at like a moderate dose. We didn't change their diet at all. We saw in about 6 to 8 weeks a 50% drop in the Sibo level and about 70% resolution of symptoms. Some of the people had no more symptoms. But so then we decided, okay, let's be a little more aggressive. Let's combine the Biocidin with the olive virex, because the olive leaf seems to have a better affinity for the methane producing bacteria. So even though we saw a huge drop in the hydrogen producing bacteria, the methane ones sometimes would then be higher because they're all that's left, right? So now we're using the Biocidin with the olive virex and the GI Detox. So those three things. And I think adding the Proflora in there wouldn't be bad, because as a spore-based probiotic, it's not going to cause the problem that regular probiotics do. And it also has a high level of quercetin, which helps stop leaky gut. So it's got a little bit of marshmallow and aloe too, which helps with motility. And a lot of people with Sibo are constipated. So now we're doing this a little bit more aggressive protocol with a little higher dosage level, and we're getting a much faster result. But that being said, there's a reason these people have Sibo, because either maybe they don't have enough stomach acid, or their immune system is compromised from Lyme or other things, and they can keep getting this back. So it's a good idea if you do a Sibo protocol like with what we have negative, then maybe like every 6 months do a cleanse again. I don't think you can ever just assume you're not going to get Sibo again. And that's the same with H. pylori. We've seen that as well. Whether you use an antibiotic or whether you use something like these, the H. pylori can go away pretty easily, but then a year later it can come back. So I think anybody who's had a chronic issue should just do an annual cleanse minimally. Excellent. In fact, I have one case that would be interesting for you to hear about. So she had rheumatoid arthritis. That was her big symptom. She'd had flare-ups for 20 years. She did her digestive stool analysis with Genova and found a very high level of Klebsiella bacteria. Now, Klebsiella bacteria is one of those ones you can see in Sibo. It has that gram-negative shell with the lipopolysaccharide endotoxin, right? It's causing inflammation. There's a direct relationship between, like I said, these endotoxins and inflammation. And in her case, it was rheumatoid arthritis that came up. So we use that exact protocol that I just said with the Biocidin and the olive virex and the GI Detox at a pretty good clip. And we had her do it for 8 weeks and then retest. And her Klebsiella was gone. And then incidentally, her RA has never come back. So she asked me what she should do, and I said, I want you to do this every 6 months. And so I talked to her recently. Now it's been like 2 years since that initial treatment, and she still has yet to have a recurrence of RA. So that was a real huge success, because her regular doctor really didn't have an answer for that. but we just
Yeah.
needed to get her gut healed and get rid of that bacteria.
And who knows what other things maybe she was dealing with that it also helped support, if she had some exposure to Lyme or she had exposure to mycoplasma or other organisms that also can play a role in rheumatoid arthritis. There may have been several reasons that something like Biocidin could have been helpful, but that's really, really cool. So with Biocidin, I know you, and we'll talk about the liposomal version, but I know you offer it in both a liquid and a capsule. Is it really just a matter of preference, or is there a clinical reason that someone might use one versus the other?
I prefer the liquid for several reasons. First of all, you're starting it up higher in the GI tract. So if there's pathogens in your mouth and in your upper esophagus, pylori is higher up in your GI tract. I think it's stronger because we run those herbs like every couple of months, whereas those capsules only get run like every 6 months. So I feel like the batch is fresher and a little stronger with the liquid. And then the liquid also lasts for 6 weeks. Whereas the capsules only last a month. They're the same price. So basically, the capsules cost 50% more. Now, the capsules are great if you're traveling and you just need something super convenient, or if you want to use it as a vaginal suppository for like a OBGYN infection. We've used it rectally too for prostatitis. So there's uses for it, but I think if you're trying to treat your gut, I would just stick with the liquid. It doesn't taste bad. It's easy to use.
Excellent. So let's talk then a little bit about the Biocidin LSF, which is the liposomal formulation. And I'm curious, what was the intent behind making it a liposome? Was it to maximize absorption and not really rely on the gut in order to assimilate the herbs? And then is this also helping to deal with some of the intracellular microbes potentially more than just the traditional Biocidin?
Right. So we had started having feedback about 10 years ago for doctors using Biocidin with Lyme. And as soon as the liposomal technology came out, I had it in my mind that it could be useful, right? Because you would get like a more, a bloodstream level penetration and so forth, and into the lymphatic circulation and intracellularly. And so I was at American Academy of Advancement of Medicine one year, and Quicksilver Scientific booth was next to me. And Chris Shade was there, and I was like, Chris, do you think you could make Biocidin into a liposomal for me? And he's like, sure. I'm like, really? He goes, sure, just send me some. So, we sent him some. We got, I think, originally like 48 bottles to try out. And there was a local doctor here who had a Lyme patient that I had been in communication about. He still had neurological symptoms, but about 3/4 of his symptoms were better, and he was doing much better, but he still had neurological symptoms. And so I thought he would be a great candidate to test the liposomal. We gave him the liposomal version, and lo and behold, 6 weeks later, his neurological symptoms have greatly improved. So I was excited, and based on that, and then sending it out to other doctors to try, it just made sense because you're getting it directly into the bloodstream. You're getting it into the lipid, cellular layer, which is again where Bartonella hangs out too. And so a lot of pathogens like mycoplasma also are intracellular. So what we found is, it definitely is working better for those types of things to use the liposomal. And, it costs a little bit more to make it into a liposomal, but I feel like it's worth it for people who need it at that level.
So I've always kind of thought with your products, I've always kind of thought of the liposomal as more for dealing with some of the intracellular things. But if someone had gut issues or Sibo or something that was more specific to the gut, I always thought more of the traditional liquid formulation or the capsule possibly. But my understanding is that in some cases, it seems like the liposomal formulation may also still be supportive of some of the GI issues. Is that correct?
Well, it's definitely going to support. I mean, either way, it's going to get down there to some extent. And then if it's getting directly into your bloodstream, you've got all that blood supply in your gut that the Biocidin is going to go to too. So I tried to test this hypothesis on myself. I came back from Peru with a parasite, and I thought, okay, here's the chance to try this out. So I took a pretty hefty amount, like 2 or 3 squirts, really bad symptoms. I think it seemed like it was Giardia. So I took 2 or 3 squirts of liposomal Biocidin and then followed that up like an hour or two later with like 2 or 3 GI Detox. And I did that for 5 days in a row. and then got a stool test. And my symptoms were gone, and the stool test was negative. So I feel like you can use the liposomal to treat the GI. It might not be necessary. You could use the regular Biocidin. It's a little less expensive. But if you're trying to do both, like let's say you're a Lyme patient who has Sibo and you're trying to treat a systemic infection, I think it's okay to use the liposomal version for both, and follow your lab test to see the result.
Okay, perfect. So we talked a little bit about viruses, but let's get into that a little bit more. We know things like Epstein-Barr virus, HHV6, that they play a role in many or most or all people with something like Lyme disease. And so you have the Olavirex formulation. You've mentioned that it has olive leaf. It has a number of other things in it as well. So I'm wondering, can you just tell us a little bit about Olavirex, and when would someone potentially want to incorporate that along with the Biocidin?
So the Olavirex, 75% of the capsule is the high potency olive leaf. We use an organic pharmaceutical grade olive leaf from Spain, and it assays between 22 and 24% oleurobin. That's a lot higher than most companies offer. It is more expensive, but then you can use less of it to get a good result. So I've had people tell me that, for example, 2 Olavirex worked for them as the same as 8 of another olive leaf capsule. So the other herbs in there are kind of almost at a homeopathic level because there's not so much of them that it would make a huge clinical impact, but they almost work just to support the organs like the liver and kidneys and the drainage pathways, and a little in support. So I think that they energetically to the formula without, like you don't have to worry about the St. John's wort that's in there because it's only 10 milligrams. It's not enough to interfere with an SSRI, for example. But St. John's wort, Hypericum, is an antiviral. And so we like to look at, like I said, the useful aspects of different herbs. And so that's why we put some of those others in there. I love that formula, and I think you can use it anytime you have any type of virus, from a cold or flu to a shingles or chickenpox. We've had people with mono use it successfully with Biocidin. Basically, I had a small group of baby horses that were doing very poorly. They had HHV6. They were at the Texas A&M University, and these were expensive Andalusian baby horses, like $20,000 a piece babies, and were failing to thrive. And so I told the breeder to try putting like a tablespoon of Biocidin and 4 capsules of Olavirex each day in their feed. And after just 4 or 5 days, they started improving, and they got better. Wow. So I've seen it. I would love to see more clinical before and after with people, but at least I've seen it in animals in one case with HHV6.
Excellent. So we know that when we're killing off microbes in the body, that there can be this Herxheimer reaction, detox reaction. Let's talk about the binders, and we've talked about it a little bit already, but we know that toxicity also plays a role in many people dealing with chronic health challenges, whether it's heavy metals or pesticides or chemicals and all of these things. So we've got the die-off from killing the microbes, but we've also got the background of toxicity as well. So tell us a little bit about the GI detox. What is it that it has contained within it, and how might it be helpful for people just to support detoxification, but also minimizing die-off reactions?
Well, I think the GI detox is a very interesting and unique formula. It's pyrophyllite clay is the main part of the formula, 75%. Pyrophyllite is from Crater Lake area in Oregon. It is a water-soluble clay, so it's unlike bentonite, it doesn't clump up. And so it's less congesting. It's 60% silica content. So the silica, as you know, helps heal the gut lining, the mucosal layers. So that's helpful about it. And then the University of Arizona studied it and found that it kills gram-negative bacteria. And those, again, are the ones with the LPS endotoxin causing systemic inflammation. So bacteria, it's 10 times more absorptive than zeolite. So it has that same structure of like a sponge absorbing things, but also electrically attracting particles to itself. So it's just a great clay. And the Indians used to use it. They called it, Iwani, sacred clay. And that's how I heard about it. I was just looking for a good clay, and I found this something called sacred clay that the Western States Indians were using, Northwest Indians. And I'm like, okay, I'm going to look into that. And when I saw the research on it, I'm like, this is really interesting. And I don't think any other companies are using that clay at this point. So then we added 25% of activated charcoal, and we use bamboo whenever possible. It's got a little better profile than the coconut, but it'll work. And so that combination we're using is that mop-up agent or sponge to bind toxins. And certainly it'll bind, if you're doing chelation, for example, it's a good idea to have a binder on board. You want to get those metals out. You want to get the breakdown of pathogens and biofilms, or breakdown of Candida, get it out. And it can be a little bit congesting because of the charcoal for some people, but most people do fine with it. I take it and I don't have a problem. The other thing that was really interesting is Dr. Jill Carnahan was doing research on it with mold and mycotoxins. And she found in her before and after studies that it was equally effective to cholestyramine for removing the mycotoxins. So she's looking at the tricosapine levels in the test. I believe that was the urine test. And she found that the GI Detox worked really well. So she's a big fan of it for that reason. And I will say personally, because I have, a history of mold injury myself, that whenever I'm feeling challenged in an environment, if I take a couple of those, it does seem to, I feel better right away. Because I don't know about you, but if I'm exposed to mold, I get foggy headed, tired, my vision gets kind of blurry. I just feel really out of it. And so I can tell the difference when I take the GI Detox, when I'm feeling that way, and all of a sudden I'm sort of back to normal. The other thing it's really good for is just in your medicine cabinet, if you happen to eat something that's not right, you get a little bit of food poisoning or something, or you drank too much alcohol, it'll absorb what's ever there. So, we use it with the Biocidin an hour or two later to pull out toxins, but if you have a reason to want to absorb what's in your stomach, you can take it with food, right?
So you can
use it either way.
So in my experience in people with Lyme disease or mold illness, it's really good to have a binder in their protocol every day, long term. I think there's an aspect of toxicity in these conditions as well. So is it reasonable to take GI Detox every day for a long period of time? And then what's kind of the maximum number of capsules one could use in a day and still kind of be within reason?
Well, I typically use like 2 twice a day, but I've taken as many as 4 at a time if I needed to. Of course, because it's going to absorb anything, you don't want to take it at the same time as other supplements, drug therapies. You have to time it when you have an empty stomach so that you can use it correctly in that way. The Iwani clay, they were taking by the tablespoon. So you could probably use a lot more than what we're saying, but with the charcoal on board, you've got that to consider. I think 6 capsules a day would be plenty for most people, or even 4. Okay. As a maintenance, you might be able to get away with, once a day.
So we know the microbiome is really important in terms of health and recovering health. We've talked a lot so far about reducing the potentially pathogenic or microbial overgrowths with some of these herbal tools. But let's talk a little bit about now supporting and repopulating the beneficial flora. And I know I'm excited, actually, I just got a bottle myself. I know you just came out with a new version of your ProFlora product called ProFlora 4R. And I'm wondering if you can tell us a little bit about that, how it's different from what you offered previously.
Well, the previous formula we had was also the spore-forming bacteria, but in a liquid supernatant form. So it's like the soup that they grew them with. And it had some nice herbal cofactors in there. I really liked that formula. And unfortunately, the manufacturer who was making it was like a small company, and the father died, and the children weren't able to continue the business. So we had to look for something else. And so I started doing research, and I really liked the strains that that the pharmaceutical companies were using for spore-based organisms, like the HU 58 form and so forth. And so we were able to contract with a distributor of those forms. And then I thought about, like, well, what else would we want in there? we would want to cut down on inflammation, and we would want to help with motility and provide some food for those flora, right? So using the marshmallow root provided the soluble fiber for the beneficials to help thrive, and also stops constipation, and it's anti-inflammatory itself. But I was really excited about the QU995 quercetin, because that is 170 times more absorbable than regular quercetin. Again, it's a pharmaceutical product. We were able to find it is a little bit more expensive than regular quercetin, but I felt like if it's 170 times more absorbable, you're getting a lot more bang for your buck there. And the clinical trials were on 100 milligrams of quercetin, showed that it healed leaky gut. So there you go. We got something that'll help shrink those tight junctions and work on leaky gut. It's going to be anti-inflammatory, and then you've got your spore-forming probiotics that are going to get in there and help to restore the microbiome balance.
And correct me if I'm wrong, but one of the things with some of the probiotics that people have to consider is that some probiotics can be a problem in those that have mast cell activation or histamine issues. My understanding is that the spore-based organisms in the Proflora 4R combined with the quercetin, that both of those things actually potentially are also helpful for dealing with histamine and mast cell activation. Is that right?
Exactly. So I'm super excited about this. I've been using it myself since we got it in, and I actually saw a benefit immediately, because I will get inflammation if I'm exposed to toxins, environmental toxins particularly. And I at the conference, I was riding in the Uber coming home from the restaurant, and they had like a scented air freshener thing right on the vent on the dash, and it was like blowing in my face. And that's like my number one, like chemically scented products will just send me, down really fast. And I felt horrible when I got out of the car. I was like doubled over. I was dizzy. I was nauseous. And I'm like, oh my God. I'm like, couldn't decide between, should I take the Gi Detox right now, or I take the Proflora for the anti-inflammatory hit? So I took the Proflora first, and then like an hour later, I took some Gi Detox, and I survived. So that's a good sign, because when I get those hits that are that bad, it could take me a day to recover. Yeah. So, the reason for people like us who I have the genetic, SNPs for pore detoxification. I have the MAOA, inhibition. There's a lot of things that I've got going on genetically and metabolically that make it really hard for me to deal with toxins. And I'm sure a lot of people listening to this are in the same boat. I think 25% of us have that genetic factor of not being able to detox mycotoxins, right? So we're like the canaries in the coal mine, whereas, somebody else could handle perfume or cigarette smoke, we can't. And we need tools on hand to help us to stay healthy.
Absolutely. So I know there are people who are sensitive to things like salicylates and phenolics and other substances that may make it difficult for them to use some herbal formulas. Are there certain people that maybe aren't good candidates for your Biocidin or for any of your other products?
We've seen with kids that have sensitivity to phenolics, particularly the autism and spectrum children. If they use that no phenol enzyme from Houston, Houston's a great company. I really like their Trienza. I really like their no phenol. Their enzymes are very helpful in cases like that. I think if you have those enzymes on board, you're okay, even if you're a little bit sensitive to.
Awesome. Yeah, that's fantastic.
Ingredients that have the phenolics are the very ones that are going to go after the gut inflammation and so forth.
Beautiful. Yeah, that's a great clinical tip. Thanks for that. So before we bring things to a close, I want to talk a little bit about sinus and dental issues. So we know that in people dealing with Lyme disease, with water damage building or mold illness, we know that MARCoNS, which is multiple antibiotic resistant coagulase negative staph. So this is a bacteria. We know that that's common for people to have in the sinuses. Some people will use pharmaceutical options like bag spray. Is there some way that we can utilize the Biocidin formulation to address the colonization of these staph or microbial overgrowths in the sinuses?
So we have done that kind of experiment with MARCoNS and with MRSA in the sinuses. What we do is we take the liquid Biocidin and put it into like a little nasal spray. I'm just see if I have one here on my desk. I don't have one, but you like a 1 ounce sinus spray with saline. Just find one that you can unscrew the cap. Or if you have one of those little squeeze bottles, the Meta Sinus that you can spray. So you can put about 10 to 12 drops of Biocidin per ounce of water and use that several times a day for maybe 3 to 4 weeks if you've had like a long-term chronic problem with sinus infections. And that has been really helpful. You can also put it in a nebulizer mixed with a little water. So I like using the Biocidin that way. I think it's an effective way to use it. And Dr. Mogiani at the ILADS conference, he's like the famous researcher of Bartonella. He himself had a 20-year sinus infection, and he took the liposomal Biocidin and put it on his finger and just stuck it up his nose. That was his answer to using Biocidin, but he said it worked. And I haven't tried it that way, but apparently, you just get the Biocidin up there in one way or the other. Just use the liquid or the liposomal. Obviously, don't use the throat spray because that's got alcohol in it. That's going to burn.
Okay.
So that you'll have to try that one, Scott.
Yeah, no, I will actually. I know when we talked at ILADS, it was on my list of things to explore. I kind of think of, colonization of microbes in the sinus is almost like, flossing your teeth. I mean, I think we just come into contact with things, and every now and again, kind of like you were saying for parasites or other things, we just need to do some type of maintenance cleansing. And so I am definitely interested in trying it. Let's talk a little bit about the dental issues. So dental issues, dental microbes and infections and things contribute a lot to the body burden of microbes and can contribute a lot to symptoms that people are having. So root canals, dental cavitations, things of that nature are fairly common in the Lyme community. I know you recently came out with Dental Sidon, which I've been using for probably a couple months. Right when it first came out, I got a couple of them. And I know that combines some of the Biocidin in as well. And then people can use the Dental Sidon along with, in some cases, the liposomal Biocidin as kind of a rinse. So can you tell us a little bit about how people are using it? I know you guys have actually done some research, which I'm excited about as well. And is it possible that this is helping in any way with cavitations, or is this more for things other than cavitations, in that cavitations are often fairly deep in the tissue?
Right. So Dr. John Rothschild in Durango, Colorado, is a dentist who had a patient whose mouth was absolutely full of spirochetes. And so I don't know if you can see on that, I'll try to move my computer, but
yeah, I can see the biofilms.
You can see at the bottom of that.
Yep.
The last picture down there. There's a picture. Yeah, so that was a scraping from that patient's teeth. We found was just all these spirochetes, all this bacteria. So we had them swish with a liposomal Biocidin for 6 weeks and then come back and scrape it again. And then after, it's like they're almost all gone. So Dr. Rothschild did this on I think 10 or 12 patients and got the same result, that it really cleaned up the periodontal picture of pathogens and biofilms. So then he decided to do a study on the cavitations. So what he did is he had a root canal patient. He went in, he debrided the bone because the bone was infected, and he used ozone at the site and then the Biocidin at the site, and then he closed it up, and then he had the patient swish with the liposomal Biocidin again for 6 weeks. And then they came back, they opened the site up again and tested the piece of bone with the DNA testing. And what happened was it went from having 35 different pathogens in that bone, including HPV and all kinds of very nasty bacteria. It was really shocking. And they only had 3 normal bacteria. So we've only done 6 patients with that cavitation study yet. And again, it was done with ozone in a dentist office. So somebody's going in there and cleaning the area, right? But based on that, I think Dr. Rothschild feels that it's a great idea for anybody who has cavitations to swish with the liposomal Biocidin, that it really may help, and try to get their dentist on board with that, or find a biomedical dentist to work with.
So just to be clear for people listening, though, we're not suggesting that if someone has a cavitation that this would replace the need for going in surgically and removing some of that necrotic bone, but it can be very supportive, and it sounds like potentially helping it to heal and minimize the chance of a recurrence of that issue is what I'm hearing. Is that correct?
That's what we're believing at this point. Now, we have had people who've had abscesses and things tell me that they didn't want to take antibiotics and that they wanted just to use the Biocidin, and it worked for them. So I think that this is going to be a great tool to help with your oral health, and we need to do a larger university study to really get some more significant data. But I'm super encouraged by it. And based on what we saw, I'm in the process of working on a dental Sidon rinse where we've taken the Biocidin LSF and we've added some specific components for the gums like myrrh and clove, and then a little bit of mint for, kind of a better flavor for a rinse. And so I just got the first test sample of it. Here it is.
Yay, I'm excited.
Dental Sidon rinse.
Nice.
And I thought it was okay. I mean, it's pretty strong, and the clove and myrrh are kind of strong tastes, but they're super, super antimicrobial in the mouth. And so hopefully we'll have that out maybe by the first of the year.
Awesome.
And so we'll, it'll be more specific for oral care, and it'll be a little bit better consistency for swishing than the LSF, but you can use the LSF for now.
So until then, because I know people will email and ask, when you're doing the LSF swish, do you then swallow it, or do you generally want people to spit it out, or does it matter?
I don't think it matters. What I've been having people do is brush with the dental Sidon toothpaste and then put in 1 pump of the LSF and swish. Just remember, though, that if you're swishing with LSF Biocidin, it is going to have a systemic effect. And if you have Lyme, or if you have some serious pathogen going on, you may get some die-off. You may need to put that 1 pump of Biocidin in water and swish with that. You may need to dilute it, or you may need to have the Gi Detox on board to deal with any mop-up. So the good test is if you take Biocidin and you start having a reaction, good news. It's working, and slow down. Get the binder on board, and it's going to be helpful to you. Do you remember the girl who did the Under Our Skin movie? What was her name?
Well, there was Mandy, there was Dana. Do you mean one of the people
Dana.
In the film? Okay, Dana, yeah.
Yeah, the one who worked for Bono for you too.
Oh yeah, that was Dana Walsh.
Right. So Dana came up to me at one of the conferences one time, and she took 1 spray of Biocidin throat spray and started herxing. And she was like, wow, nothing's made me herx in a really long time. This is good, actually. But just so you know, if you need to be prepared for that. So whenever you start something like this, work with your doctor. Do it on the weekend when you don't have an impending work deadline or something, in case you have a reaction. I'd say 80% of the people don't have a reaction, but the 20% that do, it can be extreme. So you want to go very slowly.
Right, absolutely. The one thing about the dental Sidon and Biocidin LSF that really excites me is the research that's coming out about the pathogens in the mouth and how they contribute to dementia and Alzheimer's, and how they find these things in the brain. And so, I think it's really critical, not only people dealing with Lyme, but just in general, the more we can deal with these pathogens in our mouth, we may prevent, later neurological type issues. At least that's why I tend to focus so much on this area, because it's really amazing what the research is showing in terms of the oral pathogens that affect the brain.
Right. Not only the brain, but I think the American Dental Association actually published this big warning about dental bacteria causing heart disease. And I'll have to find that study, but basically, yes. And the oral bacteria could be getting into your gut and reseeding your Sibo or your other. So taking care of your oral health is important. I think it's one of the key things. And I've been using the dental Sidon now since it came out. So it's been months. And, I had it at home and I ran out, and, of course, I have a whole warehouse full of it here at the office, but I kept forgetting to bring it home. And so I'd run out at home, and I had gone back to using the old tooth powder that I had, which was nice. It was like a baking soda and salt one. And after 3 days of forgetting to bring more dental Sidon home, I noticed the film starting to come back on my teeth. So I can attest personally that this is definitely helping my oral health. And the dentist and doctors that have been measuring the probing depths have said that their patients' pockets are coming down in half. So that's
Wow.
good news, because one of the dentists I spoke to the other day, he said, if you have 4s and 5s in your pockets and they're telling you that you need to have root planing, if you do the dental Sidon and then the LSF rinse, you probably can get out from having to have root planing, and who doesn't want that,
Yeah, absolutely. That's amazing. So I know we definitely want people to be talking to their doctors when they're using the products. This is not something, again, that people should go off and do on their own. However, for those people that are interested in working with a practitioner, Dr. Fresco has been kind enough to set up a free shipping code for people listening to this show. So if you go to her site, biocidin.com, you can use the code BetterHealth, and that will get you free shipping on her products. So thank you for that, Dr. Fresco. And as we kind of wrap up, I wanted to finish with the question, what are some of the key things that you do on a daily basis in support of your own health?
Well, for myself, like I said, I have detoxification defects. So for me, it's super important to do far infrared sauna. I got my biomat from you, Scott. I love the biomat. If I don't have time for a sauna, at least just getting my core temperature up and having a little mild sweat is always good. I put it on the massage table when I get massage, and every week I get lymphatic drainage work. I take things like homeopathics, like BioResource has that Iteries cream. I use that in my lymph. Of course, I eat an organic, relatively anti-inflammatory type of diet. I stay away from gluten and casein myself. I do yoga and Pilates and meditation every day, and I walk like an hour. And I just try to keep myself in the best shape I can, because I know when I go to these conferences or I step out of my little clean zone that I've created for my life, it's going to be hard. And if I'm not already detoxed and clear, it's going to be that much harder. So I think that's important. I think diet is probably the number one thing, having a healthy, balanced diet, keeping your blood sugar level. Those are all key things for me. I
Beautiful.
don't drink coffee. I don't drink alcohol. Other people, I see them having fun and drinking. And I can't do it. My body just can't detoxify enough to do it. So, it kind of forces me to be sort of clean and green.
Beautiful. Some great recommendations there. It is wonderful to have you on the show today. You've been at this for a long time. These products have been available now, which is amazing, for over 20 years, and really helping lots of people with your knowledge, with your products. It's great to have someone like you that really not only believes that Lyme disease is a real condition, but then also works to come up with solutions to help those of us that are either dealing with it or have dealt with it. So I just want to thank you for everything that you do, and thanks so much for taking time to be here and share with us today.
Thank you, Scott. I'm really happy to have come on. And I forgot to mention, too, that I'm sponsoring the Tickplex test, which is a new test, which is like a third of the price of current Lyme testing. Like for $70, you can get a basic Lyme test, or for $200 and something, you can get like all of the co-infections. And it's hundreds of times more sensitive than current Lyme testing. So I was helpful to the company in getting that to the U.S., and right now it's available through Armin Labs, ARMIN Labs. But we'll have it available through other labs too as well. But I just want to say, if there's people listening who want to do before and after checking to see how they're doing with their protocols, that this might be an inexpensive way that they can do that.
Excellent. Thank you so much for being here, Dr. Fresco. I appreciate it.
Thanks, Scott.
To learn more about today's guest, visit biocidin.com. That's biocidin.com. I appreciate your support of the Better Health Guy blogcasts series. If you'd like to follow me, you can find me on Facebook and Twitter as Better Health Guy. The show can be found on YouTube, iTunes, Google Play, and Stitcher. If you'd like to support the show, please visit betterhealthguy.com/donate. And if you'd like to be added to my newsletter, please visit betterhealthguy.com/newsletters. I'm looking forward to many more shows ahead and appreciate your interest.
Thanks for listening to this Better Health Guy blogcast with Scott, your Better Health Guy. To check out additional shows and learn more about Scott's personal journey to better health, please visit betterhealthguy.com.